Hi, this is Dr. David Klein with Stages of Life Medical Institute. I've got a short message for you as you're starting to look at returning to work, looking at returning to function, society, and whatnot. Things have changed a little bit in terms of your attitude with regards to infection. If they haven't, then you need to wake up. This has been long overdue. We have a large society, a world community that's gotten denser and denser and denser in terms of population. When this happens, inevitably we end up with a thinning of the herd. The thinning of the herd is almost always either war, famine, or pestilence. Well, this year, the winning number is pestilence. So you have to be careful with regards to infection control. In other words, keep it to yourself and hopefully others will reciprocate. So as you return to work, you need to look around at the sorts of behaviors that have kept you alive thus far, because there's at least one more pile of dog poop out there to step in before the summer. And that's going to happen when we all go back to work. There's going to be another little peak of people getting sick and some dying. You just don't really want to be counted among those numbers. All right, it's just not a good place to be. Being dead is not necessarily a good goal, certainly not a long-term one. Now, first thing you need to look at is when you do go back, how are you going to go back? Are you going to be driving? Okay, and the answer is probably. Most people are driving by themselves, but there's a significant number of people, in particular where I grew up in DC, where they carpool. Now imagine this for a second. We're trying to get people away from being socially proximate. In other words, elbow to elbow in the back of a car or the front of a car. So you're going to drive for an hour, hour and 30 minutes from Gaithersburg, Maryland to the Pentagon, right? Okay, if you're lucky if it takes an hour and a half, with a car full of people. Does this sound like a brilliant idea to you? And the answer is it probably isn't. So you need to start thinking in terms of segregation, separating yourself from other people. So how do you do this? Okay. Easiest solution, the one that's going to come to mind is, well, gee, let's use mass transit. Let's take the train, okay, from Gaithersburg down to the Pentagon, and you can do that. But you have to take certain precautions as you do this. They don't clean these cars, they don't clean the seats, they don't clean the handrails, or even the turnstiles very frequently, not frequently enough. So you're going to need to travel with hand sanitizer, gloves, mask, and understand that every time that you go out there and you slap your hand against something, at least 100 people, one or two of which are going to be ill, just shook hands with you. So take it with you. If you don't carry a purse, I don't, then you want to carry some kind of a backpack which has this type of equipment in it, things you're going to need that you never thought you were going to use before. If you carry a lunch pail, as I do, you can throw it in there, because I never forget my lunchbox. Little Timmy's lunchbox. Gotta love it. What if you commute by plane? This is even worse. Why? Because now you're stuck in a cigar tube for some period of time with recirculated air. That tray that's in front of you that you're working on with your computer, somebody 2 flights earlier changed their child's diaper on it. Okay? So understand how this is going to operate. The worst of the bunch are subways. Thank God we don't have them here in Florida. Why? Because you can't dig down 6 feet without hitting water. So there are not going to be any subways here. But guess what? In DC, Baltimore, Boston, New York, there are plenty of them to be had. And you are in crammed proximity. So these are probably the worst of all. Taxi cabs in New York, enough said. Okay, you might as well just sit in one of those porta-johnies, okay, for as much cleanliness as you're likely to get there. As far as Uber is concerned, they tend to do a lot better with cleanliness. It's not uniform, but it's actually pretty good. The bus is one of my most interesting things here. Now, if you want to go and see a cross-segment of society, okay, there are 2 places you can go. You can go sit on a bus, or you can go to Walmart on a Friday night, and it's the same population. So you need to be very, very careful about changing your clothes after you get to work, because no telling what's going to be growing on your trousers or on your shirt or sweater or coat, or the rest of you for that matter. So be very, very careful. The last little piece of it is something you may not consider, and that is toll booths. What's this all about? Okay, when you go ahead and you go through a toll booth and you hand somebody $5 against a $1.20 toll, they're going to hand you back pieces of paper that have been handled by lots of people, and change handled by lots of people. You have just shaken hands with 50, 60, 100 people at one time. So if you can in your community, get one of those automatic toll business. So you slap it up into your windshield, you can roll through, and they bill you directly. Why? It's just one fewer thing, one fewer way that you can get infected by somebody else. The same thing, of course, is true when you do a drive-through at a restaurant. You're driving through, you're going to hand them money, they're going to hand it back. They're wearing gloves and you're not. Okay, who do you think's getting tagged on this one? So return to work. We need you. Okay, I've been working. I need you. Okay, but be safe about it. Be thoughtful about it. Take care of your kids. Make sure they understand that this is a game of tag, and the loser could die. Tag. I don't want to be it. This is Dr. David Klein, Stages of Life Medical Institute, wishing you a safe return to work, safe return to school, safe return to life.